Thai woman 45 years old, light skin, her hands hold the abdomen. She has pale face, flowing. She comes for treatment at emergency room because of stomach ache. The nurse introduced herself and asked the patient name.
May I access your vital signs, please? Your vital signs are normal. What are the symptoms now?
Right stomach pain began to ache yesterday and gradually grew stronger, and then with nausea and vomiting.
How much pain do you rate? Extreme pain is 10, if no pain is 0.
Score 7.
Do you have any medical conditions?
I have congenital disease, is hypertension and diabetes.
Have you ever been allergic to medication or food allergies?
No.
Waiting for a doctor to assess the symptoms?
5 minutes later, the doctor walked to the patient bed.
What are your symptoms?
2 hours before coming to the hospital, I had light stomach pain, began to ache yesterday, and gradually grew stronger, and then with nausea and vomiting.
How is the pain?
There is pain in the area around the abdominal pain that occurs.
May I have your physical exam? Did I play the stomach and let you feel more hurt?
Yes.
You should have appendicitis. I'll send you to ultrasound again to be sure.
Ultrasound result.
From the result of your ultrasound examination, you have appendicitis. You must have surgery.
Patient admitted at female surgical ward.
Hello, my name is Anisha. I'm a nurse at surgery ward here. What is your name?
สมศรีมีทอง
How do you feel right now?
Now I feel very stomach ache. That is very painful. I feel really bad.
May I assess your vital sign? Your vital signs are normal. How much pain do you rate? Extreme pain is 10, if no pain is 0.
Score 9. I'm uncomfortable now.
Okay, I'll notify to the doctor.
When the doctor comes to female surgery ward and walked to the patient bed.
My name is Sri Yakon. I'm a doctor. How are you? Are you feeling pain now?
Yes, I have a stomach ache now.
Okay, I will give the pain relief medication. I plan treatment as operation. I give you nothing but a rod to wait for operation. Then we'll have the nurse to explain the preparation before going to operation.
The doctor wrote that order is give morphine 4 mg IV every 4 fluorinate, 5% dextrose in house sodium chloride 1000 ml, IV 80 ml per hour, oil at left arm and metronidazole 500 ml, IV every 8 hours stat. The nurse prepared medication and walked to the patient.
What is your name, please?
สมศรีมีทอง
I will give the pain relief drug and give you 5% dextrose enhanced sodium chloride 1000 ml, IV 80 ml per hour, or you at left arm.
Yes.
Do you acknowledge your operation?
Yes, I know.
Do you have any questions or concerns?
No.
The nurse explained the operation and signed the consent form. The skin area that is to be operated and surrounding skin area must be clean. The nurse has prepared the skin for the surgery.
This time we will teach you to take a deep breathing exercise and effective cough.
the patient when returning from the operating room?
Nurse treat deep breathing exercise and effective cut. Next morning, the patient entered the operation room and prepared urine catheter set.
Mrs. Somsemitong, it's time to go operating room.
Nurse checked the order to prepare patient to the operating room.
What is your name, please?
สมศรีมีทอง
May I ask that your vital sign?
Yes
Your vital sign are normal. May I see the wig tag? Did you already take off your danger, jewelry, and nail polish?
Yes I have took off it all and washed your nails
The nurse sent the patient to the operating room. After the surgery, at 10:30 a.m., the patient returned to the ward. Nurse assessed vital signs and changed clothes for patients.
May I ask that your vital sign and what are your symptoms of dizziness and vomiting?
Yes I have feel dizzy nausea and vomiting
I'll come back again and set the vital sign a little bit often after surgery.
Post-operative vital signs must be evaluated every 15 minutes 4 times, 30 minutes 2 times, and every 1 hour until vital signs are stable or normal. At 11 a.m., the doctor visits to the patient's condition.
How are you feeling?
Now I feeling wound pain causing me to not dare to move because of fear of increased pain.
After surgery, the pain is normal because its tooth is injured. If the pain is severe, you can request pain medication from the nurse.
Thank you.
Next morning,
Mrs. Somsemitong, did you burp or fart yet?
Not yet. May I have a drink?
No, the intestine have to start moving first. You can't start drink water. So you have to move, that the intestine begin to work.
When will I start eating?
If there is no bloating, the doctor will start feeding liquid diet, soft diet, and regular diet respectively.
To start, sitting on the bed, lying on her side with your elbow to sit down. From then, stand up inside the bed, walk along the bed and walk filters. As getting out of bed faster will improve the circulatory system and bowel movements make the intestine work well.
Are you remember? If you cough, how you need to do?
I remember. If coughing, require a hand or a pillow to support the wound and prevent from splitting and reducing pain.
at 2 p.m., nurse assessed vital signs.
Mrs. Somsemitong, have you birthed or fed today?
That is a fast way. Now I'm start walking around the bed.
Very good. Keep doing.
The nurse notified to the doctor that the flat patient, then the doctor start to take the shift of the patients. At 6:30 p.m.,
Can I assess your wound? How are you feeling?
Still pain.
The wound has a little blood. It's normal because it's that has surgery.
Then how to take care of this? What should we be aware of wound?
When you rub the body dry, don't let some water into the wound. Please be aware don't get the wound hurt because it will become infected.
day 2 after surgery, the patient condition improved and nurse have recommended wound care to prevent infection. Day 3 after surgery.
How are you? Are you hurt? Are you burning?
It is a lot better now.
Okay. You will go home in the afternoon.
Thank you.
While waiting for relative to go home, and the nurse told about how to take care of herself when returning home, and observed symptoms must return to doctor before the appointment.
I'm Onisha Artushan Shivnuri, grade 9 patient named Somsi Mitong, at 45 years old. She complained to her before coming to the hospital. She had lost so much pain, began to ache yesterday and couldn't get stronger, and then with nausea and vomiting. Recent illness 1 day before coming to the hospital. Pain around the navel, neck, moved to pain in the lower stomach. Have more pain while coughing, walk and move. Have nausea and vomiting together. Participate none. Underlying hypertension with DM. Diagnosis: appendicitis. Treatment: ultrasound abdominal blood flow check (CBC), blood group, clotting time, hemostasis. Operation on call as of May 2020, 9:30 a.m. In the morning, opened the wound and found that the wound was swollen and therefore notified the doctor. The patient complained of severe pain. Patient is sick. Therefore, gave paracetamol 1 tab and also gave metronidazole 500 ml IV every 8 hours as antibiotic. The doctor assessed the wound and said the dead wound was already inflamed but not yet infected.
Did the doctor allow patient to have some food?
All should noted to be a soft diet.
Is there anything more?
On the next shift notice, the doctor ordered a regular diet to help discharge plans.
I got it. Thank you.
Conclude. The patient name Somsi Mitong, 45 years old. Diagnosis: appendicitis. She complained 2 hours before coming to the hospital. She has right stomach pain, began to ache yesterday and gradually grew stronger, and then with nausea and vomiting. Present illness 1 day before coming to the hospital. Pain around the navel, moved to pain in the lower right stomach. Have more pain while coughing, walk and move. Have nausea and vomiting together. Treat: female surgical ward. Operation: open appendectomy.
Nursing procedures. 1. Puncture blood and provide an intravenous solution. 2. Explain about surgery, including before and after surgery. 3. Sign a surgical consent. 4. Prepare the patient after surgery. 5. Shaving and cleaning skin before after surgery. After surgery was completed, the nurse explained practice of appendectomy to patient and relative.